So this is a question that says, do you know if eating this way, which I'm assuming means eating the way we eat, which is whole food plant-based, helps with inflammation or joint pain? My knees have been acting up lately. So this is a question close to my heart because the most common cause of joint pain is osteoarthritis, and I have that in my left knee. And osteoarthritis is when the cartilage in joints wears down, and it can also mean an inflamed synovial fluid in the joint. But there's other reasons for joint pain. So it could be rheumatoid arthritis, which is an autoimmune issue, or stiffening of ligaments, tendons as we get older or we become sedentary. Gaining weight puts stress on the joints, and also losing muscles as we age means less stability around the joint. So the person who wrote this in, I'm not sure exactly why you have joint pain, but those are all the reasons that might present. And the unifying cause is whole body inflammation. And so if we can lower inflammation, we can really help with joint pain. Now, a lot of people want to do that. Doctors will just hand you an anti-inflammatory, like non-steroidal anti-inflammatory drugs, also called NSAIDs. But those can have serious side effects if they're taken over longer periods, like wearing away your stomach lining. So we can actually lower our inflammation. Yes, I was going to say caller, but you were a writer into YouTube, through our lifestyle. A whole food plant-based diet has been shown to cut inflammation by 30% in just a few weeks. So you can see that lowering it can really help with joint pain. And now, what does that mean, a whole food plant-based diet? It means avoiding saturated fat, oils, refined grains, soda, alcohol, and refined sugar, because those all raise your inflammation markers after you eat them. And especially fat, uh, saturated fat, especially. So saturated fat is found in animal foods, but also it's found in some foods like avocados and nuts. So the interesting thing is that even though saturated fat has been linked to inflammation, when people eat avocado and nuts, they're shown to be anti-inflammatory. So the question is, either is the scientists think that the reason is that avocado and nuts are anti-inflammatory, even though they have saturated fats in them, is that all the other good things in those foods counteract the saturated fat in the plant foods. Because even the leanest of meats will increase inflammation markers. So maybe it's not just the fat that will cause you to be inflamed. They did a study on kangaroo meat, which apparently is extremely lean, and they found that people still increase their inflammation. So if you have joint pain, it's important for you to avoid meat and dairy, oils, refined grains, soda, alcohol, refined sugar. Now, a lot of people say, oh, well, maybe I should have fish because they have a lot of omega 3s. And now, this one study, and I don't know how, because I've heard that fish helps with inflammation, the omega 3s in fish and fish oil. But this study showed that fish can make inflammation worse, and that omega 3s aren't linked to relieving inflammation. But Dotsie, as our study guru David Goldman has said, you kind of would have to look deeper to really understand that. One of the things they think can really help inflammation is the added fiber in a plant-based diet, because if you improve your gut health, you improve your inflammation. So it also might be, they're not sure, that it might be because you're not eating as much arachidonic acid, which is found in eggs and meats. It's also called omega-6, and that really can up your inflammation markers. Or maybe it's because a whole food plant-based diet has a lot of antioxidants. It's really hard to know exactly, but they do know that eating whole food plant-based will lower your inflammation. You can also take ginger topically, or you can ingest it. And green tea, broccoli, also really powerful in lowering inflammation. Some people talked about glucosamine and chondroitin and collagen, and those in studies really have not bared out. They haven't been found to be better than placebo. And then, for women over 50 who might be going to menopause, a lack of estrogen could cause joint pain, and a lack of vitamin D. So those are the things in terms of eating that show that a plant-based diet is really the way to go if you have joint pain. And then of course, for me and my osteoarthritis and my joint pain, I find that exercise helps a lot, and to move the joints that hurt, which seems counterintuitive. When I stretch, my knee pain disappears. So yeah, and it's pretty random when I have joint pain. So I'm pretty sure it has to do with something I've eaten, not slept. It's somehow inflammation linked.